The next guest, Carl Heneghan, is Professor of Evidence-Based Medicine at the University of Oxford and is joining us to talk about, lockdown and mask madness is back with a vengeance, Carl, but this time it's over flu. I thought we established that lockdowns and masks didn't actually work, but apparently they are back.
Yeah, so Julia, they are back. But let's be clear. First thing, flu. This is a term that is an all-catching term. So we have this thing about influenza versus flu. So if you look at the South Wales school, not only have they got influenza, RSV, they've also got viral gastroenteritis because they've got vomiting and diarrhea. So all of this is predictable, folks. It happens every winter. We get this predictable rise in acute respiratory infections, and what we've done is go into global panic and meltdown again.
Here we go.
The NHS has not prepared for this, and we're talking about 1,700 extra admissions in a population of 58 million. We're talking about...
Just get it in proportion.
A trust has to be prepared for winter for about 40, 50 extra cases to turn up. But to be honest here, it's a revolving door. We've got a new chief executive. NHS England is going to be defunct within a year. Yeah. These people have no idea. I want to tell you a story on the weekend. You know I work as an urgent care GP. Yeah. This is how bad it is. I go into the home. Somebody's seriously unwell. I can keep them in the home. I ring the crisis team. This is carers who are supposed to come out within 2 hours. Do you know what they said to us? We have no capacity. So a crisis team doesn't exist when we actually have a crisis.
That's literally what they're there for. And
so we have so many people in the back office scared, panicking, and nobody on the front line.
I was going to say the diversity officer and the net zero officer, they're on duty, they're fine. But this is the thing. So we've got schools there's one in South Wales, but other various schools closing down or banning children from singing in assembly. Again, that became one of the big things in during COVID, wasn't it? You can't sing because apparently we'll all die. But also we've got these things. Experts, we're told, experts at the UK Health Security Agency urging people to consider wearing a mask if they have symptoms of flu. Well, the thing is, if you've got flu, frankly, I've had flu once in my life. I couldn't leave my bed, let alone, walk around on the pavement or get on a bus or a train. So that's a load of nonsense. If you're that ill, you should be at home anyway. But we've established beyond any reasonable doubt that the virus, the droplets of the virus, are a heck of a lot smaller than the actual holes in the mask, and they don't work. This is so well established. Why is a health agency putting this nonsense out?
Look, it is okay for people to do what they want to do, but for the UKHSA to provide advice which is not evidence-based is now unacceptable. And this is another organisation in the NHS that spends hundreds of millions of pounds that is dysfunctional and could disappear, and we would make no difference to what's going to happen.
We'd probably be safer. But again, OK, you're ill, you can probably infect a load of people, but wear a mask. Well, no, I've got elderly relatives in their 80s. I don't visit them when I had a rotten cold the last 2 weeks, and I said, look, I'm not going to visit you because I've got a really rotten cold and I don't want to give it to you because it might affect you even worse than it's affected me. I mean, that's just normal people, being sensible, isn't it? But I mean, in terms of, where we are, again, we've had a COVID inquiry, which we know is a load of nonsense. It's still ongoing, costing a fortune. And they seem to be looking at completely the wrong questions and certainly coming up with the wrong answers. And we discussed that recently, you and I. But this is why we need a proper COVID inquiry to actually establish that lockdowns don't work. That's why they were the opposite of the pandemic plan. Masks don't work. That's why they weren't advised at the beginning and not normally advised. I mean, but most of the lessons that seem to have been learnt from the COVID pandemic is the exact opposite of what is evidence-based.
So not only do they not work, we know that if you close schools, they're actually very harmful for children and their education. Yep. So actually you're creating harm.
Who knew? Who knew keeping kids at home for a year was going to be bad for them, eh?
The second issue here is we seem to now live in a world of fear and panic all the time.
Yeah.
You're from a generation in the 70s when we were turned up to school. If they tried to close the school, we'd have gone, well, where do we go now? My mum and dad are away. Nobody knows where we are. Different generation. But they're all linked, you see. If you understand why everybody has mental health problems, because all the time you're telling them there's around the corner, mutant strain, there's no NHS to protect you, then no wonder everybody is panicking and fearful. This is all connected. We've got the wrong people in the wrong jobs at the moment trying to help out and sort this system. It is completely failing. It's about time we had a change of tact. And please, West Streeting, not another review.
Oh, absolutely. I mean, all hail Carl Heneghan, Professor of Evidence-Based Medicine at the University of Oxford. If only he was running the COVID inquiry, if only he was in charge of all these health security agencies, who would have been advising the Health Secretary, we wouldn't be in the mess we're in now. Lots more